and then I'll go to the unit, okay? So we got the head rest, the back rest, the arm rest, the body rest. To make the arm rest go down, you push the button, and then you pull back up. You can adjust the headrest by lifting up and down, taking out if there's someone who is handicapped, like in a wheelchair, or you can adjust it for height and or size of the patient, or you can take it completely off for pedo. You don't really have to say all that verbiage. Just show us that you can adjust it or how it can be put in for someone who's handicapped, okay? We have the assistance chair, which you're going to sit in. You sit this way, okay? And you turn slightly like this. The doctor is going to sit in between your legs, so don't be weirded out. Okay, this is the doctor's chair. And then I'm going to start with the unit. So these are the arms, the pole mount, the smelling salts in case your patient faints, okay, spirits of ammonia. We have the bracket tray table for the doctor's instruments. We have the three-way that's air, water, and or both, which you call mist spray. Okay. We have the high-speed contra-angle handpiece, which the burrs are gone.
So I call it placement 1, 2, and 3. So placement high speed, just so we're saying the same thing.
Okay.
Because we haven't said that before. So placement 1 is high speed, 2 is slow speed contra, 3 is the straight, if we had both of them on.
Okay, so high-speed contra-angle goes in the first hose or the first placement, used by doctor only inside the mouth with or without water. It can rotate at 400,000 RPMs or above. Then you have next, you have the slow speed contra-angle handpiece. So speed is its first name, shape is its middle name, handpiece is its last name. So if you think of it like that, you're naming, okay? So slow speed contra-angle handpiece can be used by both assistant and doctor inside the mouth, never with water. If we take off the attachment, then we have the slow speed straight handpiece used outside of the mouth for adjusting anything made out of acrylic, used by both doctor and assistant, no water. Then we have the power or the toggle switch here is for the master switch to turn the unit on and off. If we have the compressor and pump on, the arm will stay up, okay? This is to release build up pressure, we never mess with this. And these buttons are for the doctor to adjust the flow of the water or air to the handpieces. So we don't adjust those either. This is our overhead light, never headlight, never just light. Overhead light, point it at the chest, turn it off. It has different settings. It has bright, brighter, and green for light sensitive material. Okay, next we have our assistance instruments or handpieces. We have another three-way air water syringe. We have the saliva ejector and the saliva ejector tip and hose. This is disposable, one-time use. It picks up water, blood, and saliva. Okay, we always put it in and we always wiggle to make sure it will stay. Okay. Nothing worse than it falling out when you're working chairside. Next, we have the HVE or high vac or suction. I just call it suction. I think it's easiest to remember, right? It picks up blood, water, saliva, and debris, and the little hole goes outward so that if you get the cheek or the tongue, it lets you release it easier with the pressure, okay? This is the filter or the trap where all the gross stuff goes. This is the water delivery system. We use distilled water with an ADAC tablet, where they're empty right now. We'll fill them up as we get ready to use them, and then it keeps the water clean and fresh for the patient, so it's not coming and sitting stagnant in the hoses. You don't have to say that, you just have to, okay? This is a power or supply box. If it's not working, who do you call? There you go. This is the base or the base, and you want to make sure the green light is always steady. If it's not steady, it means you guys lowered the chair or the whole thing down too far, or it's compressing on a cord. So if it's blinking, it needs to go up a little bit. This is the rheostat. It's the power to the hand pieces. So it's the gas pedal. If you look at it like a car, the compressor is the engine. This is the gas pedal. That would be the key. Okay. This operates the chair. So one is resting position. So when you first seat your patient, you put them in one so they wait for the doctor. You don't lay them down. The doctor could take a good 20 minutes to come in. Okay, then when they're ready to work, we go to 2. And that lowers our patient in a sub-supine position. Should. Okay. And then if we just needed to lift the body of the chair, it's the arrow that's going forward. If we need to just adjust the backrest of the chair, it's the arrows on the side. So this one is down, this one is up. And if we need to lower the body, it's the one closest to your foot. Okay, to release our patient, we push 0 or stop. So you guys should seat each other in these chairs and practice that. You don't want to send your patient on a Disneyland ride, okay? They didn't pay for that. Okay, this is our new Mayo tray. So it now is replacing this. Isn't this fabulous? Like pulls out for you guys. You can mix your cements and stuff once you learn that. Your instruments can go here. This is your 12 o'clock unit where your computers and your supplies will go. So it's fabulous. And I think, oh, toggle switch if you need to move the chair, which we ask you don't use these, okay? This would be if we had, again, someone who's in a wheelchair or needs extra accessibility, but is that straight over that box?
Yeah.
Oh, went too far away. Is that good? Yeah. Thank you. Okay. And then when we are done, we put the unit to sleep. So we always tuck in hand pieces away from the chair, light directly over the bracket tray table. Chairs tucked in so cleaning people can get in. And we never, ever, ever, and I'm sure she said that, leave any items attached, right? Because we don't know the next day if it's clean or dirty. Okay? So everything would come off and go back on the tray in which you're using it, or go to sterilization depending on if it was used. Correct?
Correct.
Okay. Any questions?